Welcome to the Institute for Osteoporosis and our masterclass on calcium and calcium supplementation. We trust that you will enjoy this masterclass and find it valuable. Just as a quick disclaimer, the information in this masterclass is only for educational purposes and not as treatment advice. So if you have any questions or concerns after the masterclass, please contact your healthcare provider for assistance and advice. So today we will cover the topic of calcium in a comprehensive manner. We will discuss the basic principles of supplementation, general considerations, how much of calcium, when to take it, what form, what type, who should take calcium supplementations, is there a way to test your calcium status, and does calcium supplements actually improve bone mineral density? Does it reduce fracture risk, which is ultimately what we are interested in? And then does it contain any heart risk? And is there a risk for kidney stones? And then you will end off with some practical points. When we look at the composition of bone, we now know that bone is a living tissue. It's not like only sticks or stone, but truly living, dynamic tissue, which form a very tight connection with other organs. And there's a tight crosstalk with other organs that has been recently discovered, especially with muscle, but also with other more distant organs. So firstly, it consists of an organic matrix. So organic refers to living tissue, and that forms about 30 to 40% of the bone weight. Most of this organic matter consists of type 1 collagen, which forms about 90% of the organic matrix. Also then other proteins like proteoglycans that assist with this formation of the strength of the bone. Other proteins like osteocalcin and so forth have a structural but also a functional role in the bone. But some of these proteins also form part of what we call osteokines. That means they are messengers that crosstalk with distant organs. In this case, with the muscle and muscle cells, but we have realized also with cardiovascular cells and with the brain. So this is an extraordinarily complicated tissue. Then the cells, osteoblasts, osteocytes, and osteoclasts that are orchestrating the formation and maintenance of bone health. The inorganic matter, which provides the hardness of the bone, is mostly the minerals, calcium and phosphate, primarily forming this calcium hydroxyapatite complex, but also other minerals and trace elements that are also involved and important. And a small amount of bone, 5%, consists of water. This slide only reminds us of the brilliance by which the structure of bone is able to resist extreme forces. Now, when we look at the classification of supplements, it helps us to determine what we want to achieve when we use supplements. Do we want to correct a deficiency? Do we want just to supplement intake needs, filling nutrient gaps? Or in some cases, do we want to use it as a therapeutic agent and for therapy and medical use? Now, when we look at the principles that govern supplements and nutrients, we realize it's really complex and complicated. First of all, and I think the most important understanding is that these nutrients and supplements and minerals don't function in isolation. And so the sum of the function and effect of the different nutrients is often hard to determine and to measure. And so just looking at one individual nutrient, we might actually not get the complete picture in terms of structure and function that they perform. So it's important to realize that this harmony or symphony between the different nutrients is in the end what really matters and what is causing the magic inside the body. And to understand that and also to honor that, there are different principles and laws that govern these nutrients and their interactions and interplay. One of them is Liebig's law of the minimum. And this law states that the deficiency of one essential nutrient cannot be compensated for by supplementation of other nutrients. Now, when we talk about supplementation or supplements, an important principle to remember is that less is often more. Don't over supplement. Personalization is important. We will see later on, especially a good example here is when we look at vitamin D and vitamin D status, measure vitamin D levels, determine the status, and make sure that it is really necessary to supplement. So to personalize that and other nutrients is really critical. And in the era that we live, we can do that. We have the tools. Now, we know that oversupplementation can be harmful, but we also know that the potential beneficial impact of supplements and nutrients can be extremely valuable in improving and supporting function and health. This graph just emphasizes that more is not always better. When we look at the sigmoid-shaped dose-response curve, we see that as intake increases, benefit not necessarily increases too. It might plateau at some point. This graph indicates, and this is applicable especially to micronutrients and trace minerals, shows us that there is a sweet spot for maximum benefit. And when the intake is less than the required amount, deficiencies might lead to harm. But when we give excessive amounts and we go past the upper limit, we might actually cause harm. So that's where it's very important to not over supplement. So let's now delve into calcium and calcium supplementation and look at the first few questions and topics. Now, to start off, we know that calcium as a mineral plays an extremely important and major role in different organs. We always first think of calcium as the bone mineral. However, it's a very critical mineral in the nervous system, in hard skeletal and non-skeletal, smooth muscles, and also different exocrine and endocrine glands. This map indicates the average dietary calcium in different regions of the world, and we can see here that there are many regions where the average dietary calcium intake is too little, and that includes the southern part of Africa where we live. So calcium can be obtained through diet, but also through supplementation. Now, we already have seen through our first few slides that dietary calcium has been shown to have a greater impact on bone building than supplemental calcium. And it's likely due to improved absorption with meals when the calcium is blended with other nutrients. And we have a tendency also to take in smaller amounts more frequently, which is a more ideal way for the body for absorption of calcium. So, dietary calcium, we immediately think of dairy. It's by far the best dietary source of bioavailable calcium and other bone nutrients. So it also contains proteins and growth promoting elements and a range of minerals and other nutrients that is very valuable for bone health and bone support. This slide gives us a list of dietary sources of calcium, and the top few here are actually the different types of dairy products. Firstly, we look at the calcium content, the amount per serving, and we can see that dairy by far has the highest amount of calcium. What is also very important here to consider is how much of this calcium in the diet actually gets absorbed. And this is indicated here in the last column. And we see that dairy products generally has a fairly good absorption. We call that bioavailability. But when we look at other calcium sources, fruits and veggies, meats and eggs, we see they contain a fair amount of calcium. However, we notice that the absorption of that calcium is potentially not much. An important factor to remember. So in the end, when we really want to shift our calcium status through our diet, dairy is definitely a critical source of our calcium. Now, when we look at supplements, calcium supplements come in an inorganic form. We see the carbonate salt, the citrate and glycinate salts, all available. And it's important to remember that the amount of elemental calcium in each of these salts can differ quite a bit. And it's important to consider that when we calculate the amount of calcium in our supplements to make up our total daily calcium. It's also available in organic forms, tissue type of forms that one can also utilize. When we talk about the digestion of calcium, we know that it's a mineral and that unlike macronutrients, it's not broken down by digestive enzymes. But so the digestion is actually more a form of acids that dissolve the calcium salts into an absorbable, ionized, and soluble form that then moves into the small intestine where it gets absorbed. Now, moving on to absorption of calcium. This is a very tightly regulated process. In an effort to maintain the blood calcium level tightly within a very narrow range. And the absorption of calcium is approximately 25 to 35% of the ingested calcium on average. This is very much influenced by many different factors like composition of the food, aging, and other physiological factors. So absorption of calcium happens through two different pathways. Firstly, there's this active cellular pathway in the first part of the small bowel, which is strictly regulated by vitamin D. And it's the pathway that's used when calcium intake is low and sort of in a very active way gets calcium into the system. There's another more passive pathway which allows calcium to diffuse passively through a concentration gradient. And that's usually the pathway where calcium gets absorbed when there is adequate or high amounts of calcium in the diet. Different factors, however, can also affect absorption, especially the dose that we already referred to, and it's better to use smaller doses more frequently. But supplement quality is important, and this is very difficult to verify since the supplement and nutraceutical industry is not regulated. So make sure that you get your supplements from a quality company. Hydration is important to prevent constipation, and then timing with meals is critical. Especially important to remember that calcium carbonate requires stomach acid for breakdown and best absorption. Calcium citrate, on the other hand, does not require stomach acid and can be taken with or without meals. Vitamin E status is important, as we already mentioned, and then interactions with other substances and supplements, especially iron, can interfere with calcium absorption. Other food items like the oxalates and phytates that we see in spinach, nuts, beans, and whole grains that can also reduce the absorption of calcium. Other medication, antibiotics, bisphosphonates, bone-forming medication, and high blood pressure medication. And just to look at the kidneys and its role in calcium status, valuable to remember that caffeine and high sodium that we often see in our soda drinks can lead to an increased loss of calcium through our kidneys and urine. Now, the International Osteoporosis Foundation recommends a total daily calcium intake of about 1,000 milligrams for women between, let's say, premenopausal up to the age of 50, and for postmenopausal women, 1,200 milligram per day in total. So that's dietary and supplemental calcium in total. For men, up to 70,000 milligram per day, and for women, for men above 70, 1,200 milligram per day. So the sort of general supplemental dose is usually up to 500 milligram elemental calcium per day, but one should always consider, the severity of dietary deficiency, other factors that impair digestion and absorption of calcium, and then also the severity of the osteoporosis in making a final decision on how much calcium supplements we should prescribe. So this is very interesting to find sort of 20 randomized control studies in a meta-analysis where they looked at milk supplementation and noticed a small but significant increase in BMD, plus improvement in bone markers and other markers like PTH and insulin-like growth factors that shows the beneficial influence of milk supplementation on bone health and biochemical markers. So when we look at diets that is devoid of dairy food, like often seen in vegetarians and especially in vegan diets, we know that there is lower bone mineral density in these patients. And it's very hard to reach your daily required calcium need with food only when you don't eat any dairy products. So is there a way to test your calcium status? And we've already mentioned that serum calcium is maintained very stable, and that blood and other testing is of little value to determine the calcium status. And it's more there to investigate and exclude medical condition and diseases that disturb calcium homeostasis. So in the end, it's very important to do a food calcium calculation. And there are online calculators. A very good one is at the International Osteoporosis Foundation website and calcium calculator, and certain applications like Chronometer On cell phones is also well validated and can be used to determine the amount of calcium in your meals by just popping in the different type of food over a period, and it will give you an estimation of the amount of calcium for the different items over a certain period. Now, who should take calcium supplements? It may be beneficial and recommended for individuals who cannot get enough calcium through their diets, individuals at high risk of calcium and vitamin D deficiencies and insufficiencies, and people who are receiving treatment for osteoporosis. And again, I want to emphasize that it's important to always combine calcium with vitamin D. Calcium supplementation in older individuals is very beneficial because we see a decreased intestinal calcium absorption, also lower D levels, and generally a greater, poor calcium and vitamin D status in these patients. And supplementation with calcium alone was not consistently associated with a fracture risk reduction. However, when calcium with vitamin D was supplemented in these high-risk patients, there was a clear lowered risk of osteoporotic fractures. Now let's look if calcium supplementation improves bone mineral density, and does it have any reduction in fracture risk? So several studies and trials have demonstrated an improvement in the BMD, the bone mineral density, when calcium and vitamin D supplementation was given. And that there is also good evidence that a combination of calcium and vitamin D supplements lead to a reduction in fractures. Now, let's look at the vitamin D for a moment. So, in conclusion, what we can report is that, as we already said, the combination of calcium and vitamin D is beneficial, especially in the elderly and especially where there is deficiencies in these nutrients. But in patients where vitamin D levels is normal, we are not sure if that really makes a difference in fracture risk reduction in bone mineral density. We know, however, that vitamin D supplements generally is extremely safe. Vitamin D deficiency is associated with a higher risk of falls. But in the general population, vitamin D supplementation has not been associated with a decrease in falls. So in patients where there is a vitamin D deficiency, we have seen this benefit and a lowering in the fall risk when vitamin D is replaced. So when this vitamin D dosage is low, less than 800, there has not been a reduced fall risk observed. With a dose between 800 and 1000, we have seen a reduced risk in falls. And then on the other hand, larger bolus doses was associated with an increased risk of falls. So again, we see here sort of a sweet spot where too low dose have no benefit and excessive replacement might actually increase the risk for falls. So it's valuable also just to consider the blood levels and use that also as a guide in determining the optimal dose for vitamin D replacement, with a target blood levels of between 30 and 40 as an optimal dose, 30 to 40 gram per milliliter. So here we can see the different state vitamin D status, deficiency when the level is less than 12, insufficiency between 12 and 20, sufficient level above 20, probably optimal level between 30 and 40. So when we observe vitamin D alone on hip fractures, we see there was no prevention in hip fractures when it was given alone. Now let's look at the cardiovascular risk. There was some research that found a subtle link between calcium supplements and an increased risk of heart disease. This, however, was not confirmed by most meta-analysis and further research. The cardiovascular risk of excessive calcium intake appears to be more closely related to the supplements, and we've seen that high dietary calcium actually has no risk. So it's one of those reasons why we would therefore still want to rather take most of our calcium from a dietary source as whole food. But what we can conclude from our current evidence is that studies demonstrated that standard dose calcium supplements were not associated with any significant hazard for heart disease, stroke, or all-cause mortality. And so there's no need to change the recommendations around calcium supplements in patients with heart disease. Now let's look at kidney stones. We see that high intake of dietary calcium appears to decrease the risk of symptomatic kidney stones. However, on the other hand, supplemental calcium has been associated with an increased risk of renal stones. However, the data there is still somewhat conflicting. And so, if there is a history of renal stones and there is high likelihood of benefit from a calcium supplement, for instance, in a patient with severe osteoporosis, one should not avoid calcium altogether, but one could try calcium citrate. This formulation, this salt of calcium, is much safer and has a much less risk for kidney stones. Giving it in a dose of 200 to 400 milligram, smaller doses, and more frequent, like twice a day. And the reason for that is that the citrate here works as an alkalizing agent and prevent the formation of renal and calcium stones. When we look at the gastrointestinal side effects, it's very frequent that calcium causes nausea, constipation, bloating, gas, or cramps. And these symptoms can be alleviated by switching to different supplements, different formulations and salts, trying smaller dosages more often, and just increasing taking supplements with meals. Now, let's look at some practical points around calcium and calcium supplements, and this may be some repetition, but it's good to enforce some of these important messages. So supplemental calcium is most widely available as calcium carbonate, the carbonate formulation. This requires stomach acid for best absorption, and so it's best taken with food. Calcium citrate and glycinate is absorbed equally well on an empty stomach. And these two, the citrate and glycinate, is maybe a better option for elderly, those with low stomach acid production, inflammatory bowel disease, disorders of absorption, the use of proton pump inhibitors and anti-acid medication. They can also be taken on an empty stomach. And individuals who experience gastrointestinal side effects taking calcium carbonate may actually then benefit from multiple small dosages taken with meals or switching to one of these other formulations. So the point here is that when you experience side effects from a calcium, just don't just stop it. There are different strategies where we can still continue with a form of supplementation and give you the benefit of that, and your bone the benefits of that calcium. Calcium citrate is significantly higher absorbed compared to the carbonate. And by splitting the dose, we might get also better absorption. To maximize the absorption, don't exceed 500 milligram of calcium per dose. And as the dose increases, we have realized the percentage that gets absorbed decreases. Most patients do not get enough calcium from their diets. So it's very important to do that check and that dietary calcium calculator and calculation. Use that calculator to do the calculation and see if you have sufficient calcium in your diet. You might be surprised. Calcium supplements that includes D and other vitamins like vitamin K should preferably be taken with the meal that contains some fats and oil, because these vitamins form part of the fat-soluble vitamins. Do not take your calcium supplement together with other mineral supplements. They might compete for absorption. Always take calcium along with vitamin D. Dairy products are the best bioavailable form of dietary calcium. Supplementation recommended only for those who do not get sufficient calcium in the diet and are at high risk of osteoporosis. So not everyone needs to take a calcium supplement. Supplementation with calcium alone is not associated with the reduced risk of fractures. So the general definition for vitamin D deficiency is a level less than 12 nanogram per milliliter. There are different factors that can relate to low vitamin D levels, like low sun exposure, low dietary intake, skin color, clothing habits, pollution, chronic diseases, and other medication. So supplementation is associated with a decrease of falls. That is now vitamin D supplementation in populations with a vitamin D deficiency. Very high dose of vitamin D, usually the bolus doses, like the 50,000 international units per dose, may actually increase the risk of falling and should be very carefully used. The demonstration of an anti-fracture effect is primarily seen in the population with vitamin D deficiency. Excessively high dose of calcium is one of the common mistakes in supplementation, and not combining your calcium with other important nutrients like D, K2, and magnesium. Other common mistakes in supplementation is excessively high dose of vitamin D alone, ignoring protein intake, which is crucial, also as an important interplay with calcium, and lastly, over-reliance on supplements without lifestyle and pharmacological intervention. Now, lastly, before we end off, I want you to pause for a moment and reflect on what you've learned. And I want you to ask yourself a few questions. Do you think you have enough calcium in your diet? Do you really need a supplement? Do you take one? And if you take one, do you really need it? I want you to review your supplements. Look at the quality, the form, the dose, the combination of your supplements. Do you take it with food or not without food? Do you take it with medication, other medication or not? And do you overly rely on your calcium with the hope that this will be the single most beneficial intervention to prevent fractures or manage your osteoporosis? It's important that calcium is only one important player in our interventions when we want to optimize bone health. And it's really important to also utilize and implement the other lifestyle measures, and if needed, medication. So how can we assist you? We at the Institute for Osteoporosis at Louis Leipold are there to support you. So contact us if you need any assistance, guidance, or help with your management. Thank you for attending, and I hope this was valuable. Kind regards here from the Institute for Osteoporosis at Louis Leipold. Bye-bye.